Hi everyone, my name is Vicki Hayward. I'm a nurse education consultant at the Washington Board of Nursing, and I am the nurse on the Preceptor Grant team. I wanted to give updates to some changes that will be implemented in winter 2024 for the submission process for the Preceptor Grant program, and just a quick overview of the Preceptor Grant program. Substitute Senate Bill 5582 provided $3 million of the general fund's state appropriation budget to the Washington Board of Nursing for 2024 and 2025 fiscal years for the Preceptor Grant Program. In this bill, there is a focus on acute shortage areas, including rural, underserved communities, and long-term care facilities. What are the goals of the Preceptor Grant Program? Well, we're giving a monetary incentive to Precept to help increase numbers of preceptors, increase clinical placement sites, and in the end, bring more nurses into the Washington workforce. The following are nursing preceptor requirements. All preceptors must meet the Washington Administrative Code 246-840-533. You need to have an unencumbered active nursing license, at least 1 year of clinical practice or experience. You need to precept nursing students at or above the level the student is preparing, orientation to written course objectives, student learning objectives, and role expectations before the start of preceptorship, no conflict of interest that would impact your duties to impartially supervise nursing students. In addition, preceptors should get approval from their employer to precept a nursing student. Who is eligible to participate? LPN, RN, and ARNP nurses can participate in the program. What are eligible practice sites for student nursing clinicals? Well, an eligible practice site is a clinical site that has been approved by Washington State public or private not-for-profit nursing education program for student clinical practice, as well as the nursing education program and the clinical facility must have a current clinical affiliation agreement. What are the required completion hours for pre-licensure nurse preceptors? 1, you need to meet the WAC 246-840-533 eligibility criteria. Precept an RN or PN student enrolled in a licensed and accredited Washington public or private not-for-profit school of nursing. Complete a minimum of 80 hours of clinical practice instruction per student in the last term prior to graduation during the preceptor clinical course, and out-of-state nursing school programs do not qualify for the incentive hours even if they are completed in Washington State. What are the required completion hours for advanced nurse practitioners, preceptors? Again, you must meet WAC 246-840-533 eligibility criteria. Precept ARNP students enrolled in a licensed and accredited Washington public or private not-for-profit school of nursing complete a minimum of 80 hours of clinical practice instruction per student in any term of the clinical experience of the program, and out-of-state nursing school programs do not qualify for the incentive even if clinical hours are completed in Washington State. The following are not eligible for the grant: out-of-state nursing programs, refresher clinical courses, RN to BSN programs, MSN, DNP, and PhD programs that are not ARNP nursing programs. Local, state, federal government nursing employees should confirm eligibility for the preceptorship program and considering contacting their employer prior to submitting an application to verify eligibility to participate. Starting winter 2024, there is a new submission process for deans and directors as well as for preceptors. Deans and directors will submit a preceptor verification of hours form directly to the preceptor program for all preceptors that qualify to PG verifications at doh.wa.gov. Preceptors will complete the preceptor hours reporting form via SurveyMonkey link on the preceptor webpage. There will also be a video for the preceptors on how to fill out the SurveyMonkey form. All submissions must be received by the stated due date located on the preceptor webpage. This is the form that will be used by the deans and directors to attest to the hours that the preceptors completed with the student from their nursing education program. The form will be located on the Dean and Directors page as well as on the Preceptor webpage. You will be able to list up to 10 students per form. For preceptor start and end date, the standardized quarter semester dates can be utilized, and you can submit the form as preceptors complete the qualified hours. Completing the preceptor verification of hours form. Complete as many preceptor verification of hours form needed to attest to the preceptor clinical hours with the nursing students. If a preceptor has more than one student, write the name on 2 separate lines with each student's full name, preceptor start and end date, and hours completed. All questions need to be completed. Completing preceptor verification of hour forms essential data. Write the name of the nursing school, select the type of nursing program, select the academic quarter from the drop-down list, full name of the preceptor, last and first, full legal name of the student, last and first, and select the type of student from the drop-down list, LPN, ADN, BSN, and ARNP. The start date of the preceptor clinical experience needs to be completed, as well as the end date in the format month, date, and year, the total number of hours precepted. Check the box to attest to each preceptor met the minimum of 80 hours per student. Check the box to attest that every student listed above was either a pre-licensure student in their last term prior to graduation or an ARNP student in any clinical experience of the nursing program. If the answer is no, the preceptor is not eligible and you should not include them in the above list. Please do not submit if the preceptor has not completed the 80-hour requirement per student. Prior to submission of preceptor verification of hours form, please ensure that the dean and director has attested to all information is accurate. Typewritten signatures is preferred. Email completed form by specified deadline on the preceptor webpage to pgverifications@doh.wa.gov, and preceptors will not have payments processed until the dean and director's form is received and verified with the preceptor submission. If you have any questions about the dean and director process, please feel free to reach out to me at 564-669-1016, and I'm happy to answer any questions that you may have. Thank you so much and have a wonderful day.